Hello, my name is Steve Leonard. I'm the President and CEO of Peninsula Regional Health System. Our goal at putting out this type of communication, and this communication by myself and other leaders throughout the system, is really an attempt to keep ahead of the questions, you might say, that are happening here on Delmarva by providing direct information and answers to things that folks are asking in the community. So please keep an eye on this and other videos we produce to answer your questions here on Delmarva. Patients should feel safe coming to the hospital. For the last several weeks, we've been monitoring closely the events associated with COVID-19, and our team has been preparing while making sure that we not only keep our team safe, but our patients safe as they come and interact both here on campus and throughout our ambulatory locations. I think things are functioning well across the system. For several years now, we've been preparing in many ways for these types of events. We have daily meetings to understand what's going on throughout the rest of the country and throughout the state of Maryland. But in general, I think we're well prepared. The state is asking of us to make certain preparations to expand capacity, and we're actively supporting those needs even today. Social distancing, yes, it is a new social experiment, you might say, but it is important. I think the entire intent of this is to really lessen the rate at which COVID-19 spreads. Really the purpose behind it is hopefully to keep people healthy and well and not becoming infected, but if they should become infected, the intent with social distancing is to lessen the pace and really allow the healthcare industry to take better care of the people who do become infected. The governor has enacted recent changes, taking it one step further, closing restaurants, bars, gyms, allowing restaurants to only have takeout services. I think these are good, necessary steps. You're seeing it across the country in terms of attempting to decrease the spread, so I think it's important that we adhere to those steps. What's nice about, one of the many nice things about being on Delmarva is we're somewhat insulated, so we get to keep an eye on these things for some time period before, in other parts of the country, before ultimately it may spread here. We're supporting employees, and that's probably one of the most important things we're doing in many ways. I think we've had a number of years of experience preparing. If you remember back a few years ago, we dealt with Ebola and other viruses that have spread, and we provided pretty significant training and education for our employees. That is our number one priority because we have to keep our employees healthy and well to take care of our community. So we're focusing on training, answering questions, making sure that they're supported from a staffing perspective and ready to provide additional resources if necessary. Depending upon how long this goes on, there could be some impacts to our ongoing ambulatory expansion, but I don't anticipate them to be significant. I think for the next several weeks, well actually for the last several weeks, we've been very intently focused on COVID-19 and preparing for this. And over the next several weeks, I would imagine the same. But at the same time, the process does continue with our other areas of focus within the system, both our integration with Nanticoke and McCready, as well as the expansion. So I don't anticipate significant impacts. These are long-term propositions, and meanwhile, hopefully COVID-19 works its way through and we get past this and move on to serving the community. It is important to wash and sanitize. I think the spread of, or the potential spread of COVID-19 has really highlighted some great practices that, quite frankly, we should be doing each and every year. Next year during the flu season, hopefully our learnings from this process are still there, and we could actually just become better at minimizing transmission across the board for a variety of illnesses. So it is extremely important today, more than ever, obviously, with this, but hopefully these lead to good practices each and every day in the future.